We are alive because we want to be alive. We want to be the best. We want to blow up lips on Instagram. We want to have the biggest lips ever recorded. We want to be amazing and make people feel better and look better and do all those things. So we're alive because we're alive and we want to be alive. That's the theories behind tonight. But so what is it? How good are you? How good do you want to be? What are we doing all day? We're on Instagram. We're blowing up lips. We're giving people discounts. We're kneeling down to Groupon. We're offering new patient specials. Oh, hi. From Spain. Thank you very much. MAGH 206. Nice of you to join us from Spain. I know it's a little bit later out there. It must be like in the middle of the night practically, like 1 a.m. or something. Thank you. We appreciate it. Hey, Sid Lambert, if you guys are from anywhere outside of Massachusetts or Boston, let us know because we'll give you a little wave and we'll acknowledge where you're from. Hello, Eileen. Nice to talk to you. We're live because we want to be alive. We want to blow up all of our lips on Instagram, and we're spending all our time putting pictures up, spending money on marketing, doing all kinds of things to get new patients and giving discounts, kneeling down to Groupon. But maybe we're not spending our money, our time, our effort, our focus on the best possible thing. Maybe if we focus less on getting new patients and blowing up lips and making people's cheeks look like chipmunks, maybe if we retained our patients, we might be better off. Heresy, perhaps, but think about it this way. It costs 5 times as much money to acquire a new patient than it does to retain ones that you already have. Hey, Carmel, big day tomorrow. Get to bed early. We've got a lot of work to do on Brittany's mom. So if you retain a patient, it's far less expensive and far less costly and far more productive than trying to go out and get a new patient, right? Because your yield on new patients is low. You're spending a lot of money. You're blowing up a lot of lips. You're blowing up a lot of cheeks. You're giving Groupons, you're giving discounts, you're practically giving away your services. And those patients that you're doing that to are probably not going to necessarily be loyal to you. We know historically things like Groupon and massive discounting patients just find the next Groupon or the next massive discount. They don't come to you, they come to the price. So we don't want to do that. But how about if we focus on the patients that we already have? And focus on methods, techniques, ideas, concepts to retain them, to keep them coming back. So they tell their friends about the great experience they had with you because you didn't blow up their lips and put it on Instagram and embarrass them, but rather you did what was appropriate for them and proportionate and proportional and made them look better and not freakazoid. Crazy, but I know it sounds crazy, but hear me out. So what are the secrets to good retention? Like, what do you think? And feel free to ask a question or to give me an answer. What do you think is the most important ingredient, if you will, I'm using that term loosely, to retain a patient? What is the most important thing to the patient that will allow them, that will want them to, will induce them to be retained by you? Like, what will keep them coming back to you? Anybody have an idea? Put yourself in the patient's position. When you go for a service, what keeps you coming back? Trust, value. Trust and value are 2 very good concepts. It's hard to get trust after one treatment, but maybe you do. Value is a subjective experience, but if you feel as though that was a very valuable experience and you trust the individual, that will come back. Anyone else have an idea? What's the most important part of retention? Like, what you think is the most important factor that allows for good retention? What do practices that have a very high level of retention all have in common? Good outcomes, right? Patients will pay for good outcomes, right? You go somewhere, you want your nose, your lips, your eyes, your cheek, your chin, your done. And you go somewhere and you say, oh, that's a really good result. I'm going to go back to that patient, right? I'm going to that provider. That's the most important thing, right? So if you're not getting good results, if you're not creating good outcomes, if you're having complications and hematomas and occlusions and asymmetries and all the things that can happen, you're probably not able to maintain a good level of retention, and you're probably having to really hustle. Hey, Matt Jones. Julie Kamen, how are you? Good to talk to you. Are you from outside of Massachusetts? If you are, let us know. It's always interesting to hear from people from far away. Someone's on from Spain. It's probably the middle of the night there. So good outcomes, most important consideration in good retention, right? If you're getting good outcomes, you have a chance to keep those patients. But what is the one thing that, in spite of getting a good result and a good outcome, what is the one thing that will kill your retention, right? Patient comes in, they say, don't blow up my lips like everyone else on Instagram. Just give me a nice lip injection, and you do that, and the patient's happy, and they show their friends and everything. But what is the one thing that can stop that dead in its tracks? Anybody have an idea? Hey, Matt Jones from Connecticut. Thank you for joining. The one thing that kills it is a bad patient experience, If you have a poor patient experience, right? You got a good result, but the person sucked. The person wasn't nice to you. The front desk, they ran 35 minutes late. They didn't even know your name when you got there. They mixed you up with a previous patient. Whatever they did. They didn't have toilet paper in the bathroom. I don't know. Makeup, fill in the blank. But, good results are really good results, and patients will come back. But if they have a bad patient experience, because they were primarily treated badly or just weren't given respect or just whatever it is, that'll kill you. That'll stop you dead in your tracks. That'll kill your retention. And so now you're going to have to keep chasing the new patients, which we know are really, really expensive to do. If you increase your retention by 5%, right? Keep 5 more of those 100 patients that you just saw, you can increase your revenue by more than 25%. There have been plenty of studies done on this, right? It's easier to keep what you have than to keep trying to get new patients and be in the treadmill. That's why these big chains that are just treadmills and running and kind of getting new patients all the time are often out of business within a short number of years, and they're just always in debt. They're always constantly chasing because they have no ability to retain patients, right? So, when you retain patients and they keep coming back to you for more stuff, and they tell their friends, and you have this internal referral clock going, you don't need to be spending hours on Instagram blowing up people's lips and blowing up people's faces and cheeks and making them look funny. You don't need to be doing Groupons and doing, coupons and for new patient specials. You don't need to do all that. So, hey, if you guys are from far away, let us know. Also, if you had overall experience is the key. Yes, I guess that's Jen. Yes, Jen, I think you're 100% right. So you have to have a good experience, good patient experience, coupled with at least a decent result, right? If you're a terrible injector, but you're the nicest person in the world, that might work for a little while, but then it gets old. If you're a really good injector, but a shitty person, that doesn't work either, because people don't want shitty people treating them, right? The problem is, there's so many people right around you who do exactly what you do. Many of them will probably do it better than you do and are nicer than you. So you don't have a lot of wiggle room, right? There's so many competitors in the market. And patients are very discerning. These are after-tax dollars, right, that have already been taxed, so it's disposable income. And sometimes people don't have a lot of disposable income, so they want their income to be used wisely. And if they're not being treated properly, it's just not good. I mean, even, I went to get my car service this weekend, and I had kind of a terrible, I survived, but I had kind of a terrible experience. So I don't kind of want to go back there because I spent a lot of money, and they didn't do what I wanted them to do, and it just didn't work. So what else is important when it comes to retention? Well, there was an Amex study, American Express study. 30% of customers, current customers, will switch in an instant after just one bad episode of bad customer experience. Just one episode, and they'll go to another company. They'll go to, I don't know if they'll go from Starbucks to Dunkin' Donuts or whatever, but, they'll go to another provider, right? Important to know. Hi, New Jersey. That must be Emily. Thank you for joining us tonight. So, what else is important with retention? Relationships are important, right? And how do you create a relationship with a patient? You listen to them. You listen to what they have to say. You talk to them. You have a normal conversation. You spend 2 or 3 more minutes than you would have if you just walked in and treated them, right? You spend a few minutes, and you tend to remember, your kids just started college, right? How are they doing? Your husband just got that new job in New Jersey. How's that working out? How's he? Is he like okay traveling back and forth? Are you okay? I mean, whatever the conversation is, have a conversation because it's part of the whole customer experience, right? You guys know this. It's like when you go someplace, you want people to at least know your name and say, "Oh yeah, good to see you again. It's been a few months. How's everything going?" Yeah. Pointless conversation, but like they're trying, right? And then when you get to see them and you're about to do something on them, don't just jump in. Like just talk to them and just be a person and create a relationship so that you're more than just someone on the end of a needle. Like we talked about last week, you're more than just a technician, right? A technician is someone who just, okay, I just need an oil change. Just change the oil. When you're done, let me know. I'm driving my car out. That's a technician, Or, okay, I want, that one. Can you grab that for me? Or can you fix that light for me? Those are technicians, right? There's no back and forth. There's no creativity. They're not offering you any other options. You're just telling them what you want and they're doing it. So we don't want that. We want a relationship. And what's really also important with relationships is time, right? Don't rush people. Even if you're behind, try your best to catch up, but don't ever make anyone feel like you don't have time for them. They're not important enough for you, and then you have to rush through it. That I would probably walk out, if that was happening to me as well. What's also really important after you treat the patient. So let's say that you had gum surgery or eye surgery or whatever you had, and then you go home and you're uncomfortable and whatever. So how nice would it be to hear from the provider? Say, hey, you know what? Just want to check in on you. How you doing tonight? Did everything go okay? Are you having pain? Can I help you with anything? How nice is that? Hey, I know we just got some filler today. I just want to make sure you're feeling okay. Hey, a Botox treatment that we did today, you were really brave. I know you were uncomfortable with needles. Are you feeling okay? Pointless conversations, perhaps, but really important if you're the person who just got stuck with needles or, has a bruise. Oh, you have a bruise? Can you just text me a photo? I want to be sure it's nothing more than that. How nice is that? That's one of the reasons I went into the interactions in a relationship with clients. You're in the right job. Jen, you're in the right job. Not everyone is. And I'm happy that you're in the right job because it's really hard to do this job if you don't have what Jen's talking about, right? This relationship issue. And following up with your patients, just being sure they're okay. The night of, or even the morning after, it's okay. It's really kind of becoming the standard in the industry, and it's really appreciated by patients. And if you've done neurotoxin or fillers, have them come back at 2 weeks to see if they're happy, Don't charge them anything. Hey, Green Rise, good to talk to you guys. Don't charge them anything. Just make sure that they're happy. Make sure that you've done a good job. See how good you really are, right? And, if you're not, do a touch-up. Fix them, And for the filler patients, do them slowly. Don't jump in and try to change their face all in one day. Start them off slowly. Put their toes in the water, then their ankle, then their knee. Don't just dunk them in the water and fill them up with 7 syringes. Be sensitive. Be careful. Create that relationship. Hey, I want to overwhelm you. I don't really want to change the way you look. I want to do a few syringes and see you back in a month to see how it's working out, to see where we need to go next. Give them a treatment plan. Show them that you're interested in them. Analyze their face, right? Show that you're more than a technician because everyone can be a technician. Just don't care. Oh, where do you want this? Okay, I'll put it here, here, and there. See ya. Thanks. Make sure you book next month. I need more money because I've got a big trip I have to go on. That's wrong, right? That's wrong. You have to really care about the patients and you have to really care about the results and their outcomes. And by calling them after the treatment, it really shows that you do care. And seeing them back after a couple of weeks, really more about checking up on your work than it is about them. But it's all, but they'll perceive it the same way. Thank you. Mm-hmm. Communication is really important. One of the things that I have always believed in is education. Obviously, that's what I'm doing here tonight, and that's what I like to do, and I think that's what I'm good at. But one of the few things that I'm good at, maybe, educate your patients, right? So when they come in and ask questions, take the time to explain to them maybe some of the science, maybe some of the chemistry, maybe some of your thinking about them. I don't really want to use this filler for you because of this. You've got, your skin's too thick, too thin, too this, too that, whatever it is. Let them know that you're actually thinking about what you're doing. Would you charge for a few units tweaks after 2 weeks? I personally wouldn't, because I think it creates goodwill. But she's saying, would you charge for a touch-up, for a few units of neurotoxin after a couple of weeks? I would say this, as long as you tell the patients, hey, I haven't treated you before with neurotoxin, and I don't want to overdo it. I don't want to drop your brow or give you an eyelid ptosis or do any of those things. So I'm going to be very careful with you. That's an important thing to say, isn't it? I'm going to be very cautious with you because I want you to have a really good result, but I don't want to give you too much. I may treat you on the more conservative side because I can always give you more, plant the seed in their brain. I can always give you more, but if I give you too much, I can't take it away. And if you have a bad outcome, you're going to be like that for 3 months. And I don't want that for you. So this is how I'm thinking. This is what I'm going to do for you. This is how I'm going to help you. And when you see them back at 2, and you say, and like with anything else, if you need more Botox when you come back, there'll be a charge for that. So like if you think they need 10 in their forehead and they really need 20, you got to charge for that. You're not in the business to lose money. And you warned them, you told them you were being cautious. But if someone comes back and, you've got a little spock on one side or a little asymmetry, you need 2 or 3 units, you're not going to charge them $20 or, you're not. You shouldn't. So you know what? Well, it's going to take us a few times to get it exactly right. No charge for today. This is just a touch up in my mind. And, that goes a long way to getting a patient. I mean, there was this one patient I had, and she was doing all these surgeries. And because she was doing 4 or 5 different procedures, on one procedure I didn't, I just didn't even charge her for it because it was like a touch-up of something I'd done before. She came out of the room and she's like, oh my God, I can't believe I was charging me. I mean, she was still paying a lot of money. And I didn't even, I wasn't going to charge her for a little touch-up, but she was so touched by that. She goes, oh my God, he is so amazing. I can't believe he's even charging me for this. And, so sometimes those little things go a long, long way because you don't have to do it. They're not. Yes, let patients know what you're doing step by step to relieve anxiety, especially if it's their first time. Yeah, just go slow with them. Just be gentle with them. Be tender and nice and slow. But what I was talking about is also just explaining, how things work. And sometimes when you explain how things work and say specifically how this applies to them, it shows that you're really thinking about them, that you're really caring about them, and you're not just a technician who just does the same thing over and over and over again. When we first started in plastic surgery, rhinoplasty was, kind of a new thing. Aesthetics in general wasn't really well received back then. There really wasn't much in the world of aesthetics. Now it's completely flipped on its ear. And you could identify someone's surgeon by their nose. Oh, that's a so-and-so nose. Oh, that's a Smith nose. Oh, that's a Jones. And he would do the same nose on everybody. Right? It's like giving everybody the same dose of neurotoxin or the same amount of filler. That seems absurd to us now, right? Just like everyone's nose has to fit their face, but these doctors were just like, this is how I do a nose. And you're going to have my nose on your face, And it was kind of sort of the Byzantine era, but that's how things start. Then as you get better, you start to sort of customize treatments and look at people differently and sort of analyze them and think about, we don't want to make their lips any bigger because their chin's already small and their nose is big and it'll create this crazy dynamic. So show them that what you're thinking, show them that you care about them, and show them that you're an intelligent person who's giving choices and looking at them, not being just an errand boy or an errand woman. Reward programs we're talking about patient retention. We're talking about how to retain patients, and it's much less expensive to retain patients than it is to constantly try to get new patients. That's really expensive. And the most important thing we talked about was good outcomes, and the one thing that could destroy your retention is a bad patient experience. We're talking about some of the things that give good and bad patient experiences. Reward programs work, right? Like Ali with Allergan, or some of the internal programs like in our practice. We do things like if you book and get treated with your neurotoxin within 3 months, you get you pay less money. If you go past the 3-month mark and you're past that point where you should have come in, you pay more. So it keeps them coming in, and it keeps them, I got to get there before March 10th because otherwise I'm going to pay more. Those little programs, those little incentives make a difference because they know that you're trying to keep them on track. That helps. The other really important part of this whole thing is your front desk and your nurses and your support staff, right? Don't hire people that aren't people, right? Don't hire people that don't like other people. Don't hire people that are stiff. Don't hire people that aren't knowledgeable, that are lazy. Don't hire people that are argumentative. Hire salt of the earth, nice people. They don't have to have any experience in any industry, but if you talk to them and you really like them and they're sweet people, they might be the right people for your job. Because you can train people to do this job. You can't train people to be nice. You can't change people's personalities, right? So you could have the most beautiful looking receptionist who's just an awful person and no one will like her. You can have an average looking person who's just the most sweetest, nicest, caring, compassionate person in the world who never screws. That's the person you want, right? Doesn't really matter what you look like or what you do or who you are or how long your lashes are or how big your lips are. None of that stuff matters. Because when you come in as a patient, you want to feel good. You want to feel like, hey, good to see you again, Mrs. Jones. It's been 2.5 months. We wondered where you were. That's a beautiful dress. Whatever that is, right? That's what you want. And you want to hear that all day long on the phone. And you want to hear that all day long. People laughing and smiling and joking. And people coming and saying, oh, you guys are the nicest. How do I give you a review? So the front desk staff is critical. Their phone skills are critical. You can get trained on all those things, but it's got to be a nice person, who's honest, who's sincere, and who generally likes to do that job, who generally likes to talk to people and help people. Hire me. I'm so eager to get started. Send your resume in. By the way, if you guys are interested in working with us and coming to our school or getting trained or mentored by us, go to the link in our bio. We're the Aesthetic Mentor. We're in Waltham, Massachusetts, and Glastonbury, Connecticut. We train. We do all kinds of classes. Neurotoxin fillers, cadaver, microneedling, laser, you mention it, we do it. So we're happy to train you. What are the best places to purchase product? What do you mean? You have to purchase from the company. And nurses can't purchase products. Doctors can't sell products. You have to be in the practice of someone who's doing it. There are laws against nurses buying products and doctors selling products. You can't do it. Hello, Elizabeth Hagan. How are you? The best program. Oh, she worked with us last month, so you can tell everybody about your experience and how great it was and how much you learned, because we're different, we're better, we're the best. Front desk stuff. I just want looking at my notes to make sure I covered everything. So, do any of you out there have good retention tactics? Anything you've done to notice? Like, how many of you have seen a single patient more than twice in 1 year? Like, if you see someone 2 or more times, then you have retention, right? That's considered retention. That's the definition in the analytic terms of Allergan and other people who measure it. So, how many times a year are your neurotoxin patients coming back? It should be more than 2. I mean, obviously it should be, but for most people it isn't. What's happening? Where are they going? Are they going to other people? Are you losing patients? At our level, we do. Hi, Eileen. Can't wait for the chin and jaw class and Kybella. Yeah, it's all there for you. Just ready for you to take it and run with it. So, if you're not retaining patients, you're spinning your wheels. You're spinning your wheels. So you have to examine your practice and figure out why. Are you giving good results? Are you creating a good patient experience? Are you fair with your pricing? Do you have a relationship with your patients? Do you feel like you're comfortable talking to them? Do they feel comfortable talking to you? Do they feel like you have time for them? 3X. Dr. Lind, yep, absolutely. Do you follow up with your patients after you've treated them? Or in my case, I have my nurses follow up, and if there's an issue, I get involved, right, if there's a problem. Do you offer some kind of internal reward program? Do you have the best front desk person in the world who loves everyone, who was born in Kansas or Oklahoma or Iowa and just loves everybody? Stay on schedule. No one is perfect. Yeah. Reality intrudes, but staying on schedule is a major factor. You're absolutely right. I've always stayed on schedule. I mean, it's rare if I don't, but because I don't overschedule myself. My staff, I think, purposely underschedules me. I think they purposely underscheduled me because they know I could talk a lot, and I talk to my patients. And I honestly don't want to be running, into a room, and going. I don't want that. I don't want my patients to be like, he just came in and ran out and couldn't wait to get out of it. I don't want that. I don't want to be on the receiving end of that. Stay on good. Follow up goes a long way. Patient Sid Lambert is 100% right. So staying on time, underschedule yourself. You won't regret it, because sometimes when you're in the room with the patients and they just come in for Botox and you're taking your time doing it, you say, while I'm here, I've always, wondered about my nose. Do you do rhinoplasty? While I'm here, I just noticed, you have these signs for liposuction up there. Is that something, you can have a conversation, because it's not just wham, bam, thank you, ma'am, get in, get out. I got another 5 patients. Wait. I mean, it depends what you want in life. It depends what kind of practice you want, what kind of quality practice you want, because I can guarantee you the patients that you spend a little bit more time with are going to feel like they can ask you questions about, I just saw this thing on TV about something called Botox. I don't know. What is that? Is that something I should be doing? You'll love the classes and we'll learn so much. Thank you. And I didn't even pay her to say that. She's just doing that all on her. I'm new with aesthetics. How do you get clients? The best way to get clients is to do good work. The best way to get clients is to provide great outcomes and do all the things we're talking about, and the rest will come. But you have to love it. You have to want to do it. You have to put your before and afters out there. You have to network. You have to put yourself on, unfortunately, on social media and all these other things. Getting patients isn't hard. Retaining patients is hard. And if you can do that, you don't have to go out and search for new patients, because you're keeping all your old ones, and they're telling all their friends and giving you reviews, and they're doing all the work for you. They're advertising and marketing and putting stuff on social media for you. You don't have to do a damn thing except sit back and say, I'm a little overbooked here. I'm going to have to slow down. That's what you're going to have to say. But if you come to our classes or come to any kind of class, there's built-in stuff that helps you with marketing and understanding how to get started. But you're right, getting started is the hardest thing. So does anyone else have any other great ideas about retention? Because I think the one that you mentioned was amazing, just being on time, because that shows that you're considerate of their time. I mean, how do you like going to someone's office and waiting 30 or 45 or 50 minutes to be seen? I mean, I find that to be just infuriating. Like, you don't value me or my time. Like, I'm just as busy as you are, and I'm just as important as you are, and you don't have the right to do that. I'm not coming back. I just did the intro to neurotoxins, learned so much, and the hands-on is priceless. That's what we pride ourselves on. We give the best hands-on clinical experience of anyone in the world. I fully believe that. I mean, you can take practice sessions and all kinds of stuff, and Elizabeth said, Dr. Russo and staff are the most kind and compassionate. Thank you for helping me get started. I find it is disrespectful. Yeah, if it's not on time. Listen, we all feel that way, right? It's like, I'm sitting here waiting. Like, I've got a life to live. I don't want to be waiting here all this time just because your staff is so terrible at scheduling, or you don't have respect for me and you running late. So I've always, I've never run late. And if I do run late, you know what I say? I said, I'm really sorry. I'm running late. Didn't mean to keep you waiting. I got tied up, but you have me for as much time as you need me for. Bingo. Done. Out of the way. Elephants out of the room. And you just you have to be brutally honest in this business. Hour and 15 minutes for filler. That's outstanding. Keeping appointments at 45 minutes for Botox. Unbelievable. Because that Botox, I find it disrespectful. Yeah. Allows for time to communicate. Listen, Tracy, you 100% get it. You 100% get it, because that extra time you spend is going to keep that patient coming back maybe forever, whatever it is. But they're going to tell everybody about you because it's a special thing. Most people don't do what you're doing or what you're advocating. How many people out there track their retention? How many people think they're seeing a single patient more than 2 times a year? Because it sounds easy, but if you look at the national average, like neurotoxin patients, I think the average number of visits is like 1.8 or what. You're like, well, it should be 3 or 4. Mm-hmm. It's like 1.8, 1.5. I can't remember exactly, but it's way less than you think, right? So what is it? What does that mean? Are they going to other people? Are they just saying, well, I forgot about it. You never reminded me. What's going on there? So think about that, right? The thing that we did with Botox was saying, look, if you come within 3 months of today, you get it for X number of dollars, like which is less, like $2 or $3 a unit less than normal. If you go outside that, we're going to charge you the extra money because we want you to come back. We want you to be motivated to come back. We want you to feel good about coming back because you're going to stay looking amazing, and that's what we want for you. I don't really have anything else to say unless anyone. Communications equal connection, right? Thank you. I guess it's my net. Communication is what this industry is all about. Obviously, most of the patients are women, so it's all about talking. It's all about by communicating, it's about being clear, about being transparent, about just being open and honest about what it is that you see and what you do and what you're trying to do. And patients value and trust you right away if you're honest. Particularly if you tell them they don't need something. Particularly if you tell them, you know what, I think you're wasting your money with that. But, and you're actually saying, I'd rather not take your money than do something that isn't going to really be great for you. At least in my mind, that creates a lot of trust. Because you're just being honest about it. Because you're caring about them, right? You're doing this hopefully for them to help other people, make them feel better and live their best life, right? Because we only get one chance at it. So help them live their best lives, and they sort of get that. You're saying, I'm brilliant? She's the first person that's ever said that about it. I have not paid this woman a dime. I only met her a couple of times, and I don't really know her that well, but she's saying some really, no, I'm just kidding. I appreciate you saying that. And guess who just joined? The Red.
The Red.
Geez, nice of you to join at 7:31, Red. You must have had a busy day. We just call her Red. Nice to see you. Thank you for joining. I'm just about to sign off. So we talked a lot about retention. We talked a lot about things to do and how important retention is, and certainly how much more efficient it is to retain patients and to constantly be on that treadmill and blowing up people's lips and faces and other areas of their body to get on Instagram and get noticed. But in the end, I think that hurts you. So Jen, always a pleasure. Carmel, time for you to go to bed. We have a big day tomorrow. So be humble, work hard, be honest, deliver good results, work on your retention. If you could do a retention analysis, you will be shocked at how few people actually come back more than twice a year. And when you're shocked, you'll be like, okay, I got to work on that, and then go through all the things that we talked about and see where you're falling short. So thanks for joining. Even you, Red, we got you in there right at the end. I'll see you next Tuesday. Not sure what we're talking about, but it'll be amazing. See you then. Bye.